Have you noticed a small gap in the middle of your stomach? A belly that pushes outward even when you lose weight? Or a feeling that your core is no longer as strong as it used to be? You might be dealing with something called diastasis recti. Many people think this condition only affects women after pregnancy, but that is not the full story. Men can experience it. Women who have never been pregnant can experience it. Even children can develop abdominal separation. And one of the biggest mistakes people make is believing that surgery is the only answer. Before you consider expensive procedures, you need to understand what is really happening inside your body. Diastasis recti means that the two main abdominal muscles, the muscles responsible for your six-pack, have moved farther apart than they should. Between these muscles is a strong connective tissue line called the linea alba. Think of it like a natural bridge that keeps both sides of your abdominal wall connected and stable. When this tissue becomes stretched, weak, or loses its ability to support tension, the two muscles begin to separate and a gap can appear in the center of the abdomen. The most common cause is pregnancy because the growing uterus creates continuous pressure on the abdominal wall for months. However, pregnancy itself is not the only factor. The quality of your connective tissue, your muscle control, your daily movements, and your overall body strength all play important roles. Now, there are two major mistakes people make when trying to fix diastasis recti. The first mistake is doing the wrong exercises. Many people immediately start doing traditional crunches and sit-ups because they want a flatter stomach. But these movements can increase pressure inside the abdomen and may push the abdominal wall outward instead of helping it recover. When your core is already separated, aggressive exercises can make the problem worse. The second mistake is rushing into surgery without exploring other options. In some cases, surgery may be necessary, but many people can improve their abdominal function by rebuilding strength, control, and proper muscle activation first. Your goal is not only to close the gap. Your real goal is to restore the strength and stability of your entire core. A stronger core improves posture, movement, balance, and daily activities. So what is the exercise that can help? It is a simple movement called the abdominal draw-in exercise. Here is how to do it. First, relax your body and focus on your breathing. Then gently pull your belly button inward, as if you are trying to bring it closer to your spine. Imagine you are tightening a belt around your waist. Hold that contraction while breathing normally. Do not push your stomach outward. Keep pulling the abdominal wall inward and controlled. After holding the contraction, release slowly and repeat. The power of this exercise comes from training your deep abdominal muscles, especially the muscles that act like a natural support system for your stomach. Over time, you teach your body to create better internal pressure and stronger core control. You can perform this exercise lying down, sitting, standing, or even while walking. That is what makes it so practical. No equipment, no gym, no complicated movements. Consistency is what matters. For beginners, start with a few controlled repetitions every day. As your strength improves, gradually increase the duration and intensity. But remember something important. Healing your core is not only about one exercise. Your body also needs proper nutrition, enough protein, important vitamins and minerals, good posture habits, and avoiding movements that create unnecessary pressure on your abdomen. The mistake many people make is treating diastasis recti as only a cosmetic problem. It is not just about how your stomach looks. It is about how your body functions. A strong core supports your spine, your movements, and your overall quality of life. So if you have abdominal separation, stop focusing only on endless crunches. Start rebuilding your deep core strength. Practice controlled movements. Be patient with your body. Your progress may not happen overnight, but consistent effort can create significant changes. Try this exercise today and pay attention to how your core feels. Leave a comment and tell us. Have you ever experienced symptoms of diastasis recti? And if you want more science-based health videos that explain what is really happening inside your body, subscribe and stay with us.